Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Depression can occur at any point in one's life. Today we'll be discussing the symptoms and treatment options for depression with Dr. Tom Brozovich, board-certified psychiatrist at McLaren Port Huron's Outpatient Counseling Center. Dr. Brozovich, welcome back to the program.
Well, thanks, Michelle. Thanks for having me on the show today.
Now, we hear people saying all the time, I'm so depressed, it's so depressing. What is the actual definition of depression?
Depression is considered a mood disorder, and it's very common, it's very serious. Basically, depression can affect the way that we feel and the way that we think. It can affect us in many of our daily activities, such as sleep, eating, and how we function at work.
Who is most at risk for developing depression?
Depression is known to be actually twice as common in females. It also tends to be more common if you've had a family member with a history of depression, or if you yourself have had a previous history of depression, then you're more at risk.
Is there a typical age that depression would occur for the first time in an individual?
For a first episode of depression, we generally are looking at people in early adulthood. That can often be the first episode. If someone does have a first episode of depression, we always have to be monitoring for any relapse of episodes, because it certainly can be a recurrent illness.
Now, what exactly causes someone to be depressed?
There are many causes of depression. Actually, research shows that there's many different factors. Those include biological factors, also environmental factors, and psychological factors. So it can be looked at as a multifactorial.
Are there more than one type of depression?
Yeah, there's several different types of depression, and they vary based on the amount of severity and also the length of the depressed mood.
What are some of the different types of depression that you treat?
Major depressive disorder is one that we often see, and this basically consists of a depressed mood for at least 2 weeks' time, mostly every day. And we also have persistent depressive disorder, which is a depressed mood for at least 2 years. But that depression is considered to be probably more of a low-grade depression as compared to major depressive disorder.
So for major depressive disorder, in addition to having the depressed mood, what are some of the other symptoms that somebody might be experiencing?
Yeah, there may be many symptoms that someone's experiencing with a major depression, and those include affecting the sleep and the appetite. Sometimes I find people with major depression may be sleeping not much at all. They feel like they need to sleep, they just can't, or they're actually sleeping too much and sleeping many more hours than they want to be actually. They can be feeling very tired. Another common symptom that we see is actually loss of appetite, or sometimes with major depression people are eating more than they normally would.
Now, some of the symptoms of depression can be quite debilitating. Are the symptoms different between men and women, or adolescent and children?
Yeah, sometimes we find with women that they will present as more sad, like with major depression. As opposed to men, sometimes, certainly they may have the sadness as well, but sometimes they will present as maybe more irritable or angry. And sometimes we see the same with the adolescent ages. With depression, they may present as just more irritable, more angry, and those are things we try to key in on for those different either age groups or male versus female.
Now, are those who have depression more at risk for suicide?
Yes. Yes. I think someone who's going through a major depressive episode, or they have recurrent major depression, they would tend to have more of a risk of suicide. That can actually be one of the symptoms of major depression, is thoughts of death, thoughts of suicide.
What are some of the warning signs of suicide if you think that somebody that you care about is depressed and might be thinking of this?
Right, like some of the warning signs of suicide that we like to look for, that anyone can look for, is like for adults, I think you want to look for is somebody visiting many people and almost like saying goodbye, and that would maybe be like a change in behavior. Or are they giving away items to other loved ones? Those are some things to look for. I think for in the teen and adolescent age group, we look for an increase in like risk-taking behaviors, and that would like be a change. And we also look for maybe making statements about suicide, the teen or adolescent age group.
Dr. Brozovich, this is very sobering but important information. We need to take a break. We'll continue in a moment.